Hello YouTube friends, welcome to another segment on Switch the Script. Today's topic I'll be covering how to think about healthcare policies. Yeah. So I'm not going to tell you what to think, but this is how I think about it. So on a previous segment I talked about basic needs and basic rights. So in my opinion, or how I see it, healthcare is not a right. It's a good and a service, and the only way that you can make it cheaper is through the markets. You have to flood the markets with certain goods or certain services. So when it comes to services, you flood the market with doctors so you can make it cheaper. You bring that competition to the healthcare system where those prices will be lowered over time. Okay. Now politicians will talk about, you know what, when we get into power, we'll find a way to lower the cost of healthcare. Now, what we pay for is prices, and most of the costs that are incurred when it comes to health has been taken care of the Western nations. Why do I say this? When it comes to research, when it comes to manufacturing of the drugs, most of the research has been taken care of by the Western nations. America dominates most of the patents when it comes to pharmaceutical products, and then Switzerland, I think, Switzerland dominates the patents on biochemical. Is it biochemical, or let's say pharmaceutical products? Yeah, so it's basically those two, and you're finding that it takes a lot of money for research. Now, to give you context, Kenya has 23 research facilities and you still don't have any patent for any drug. Okay, it takes a lot of money for you to research to come up with a new drug for people for different ailments. Now, when it comes to prices, because now we are focusing on how to lower the prices of healthcare. If let's say there's a sector in health that is really needs specialists. Now, if let's say you don't have a lot of specialists in that area, then those prices will be high. Look at our cancer treatment facilities. We don't have all those expertise that we need. So when they charge high, you'll have to understand, because when it comes to economics of healthcare, there's the scarcity and there's the shortages. Now, scarcity is a price phenomena. If let's say there are only 3 doctors, or let's say 5 doctors, the price will always be high, because now when the supply can't match the demand, or let's say it's really hard for people to qualify to be a specialist in a certain field, then they will charge premium for their services. If you look like let's say dentists, if we had a shortages of dentists, one way will be the government to prioritize subsidies for specific fields in the healthcare sector, where people studying to be surgeons, they can get more funding, where we can flood the market. Yeah. We can flood the market, and they flood the market with surgeons so they can easily compete for that. Now, we can also export our expertise, yes, but if let's say we weren't putting price controls on doctors, then it will encourage more people to enter these fields, because what I see mostly is some individuals would have gotten into medicine, but seeing how public hospitals treat their doctors, where they are told you'll have to treat these patients even though you haven't received your 5-month salary, or you will be fired. You see, you can just treat doctors like that. Okay, you have to just use the market forces to make it cheaper. Now, you could also encourage the private sector to continue building hospitals, because right now the private sector has more hospitals than the public hospitals. Yeah, I was surprised too. And right now, the private hospitals are clocking at 103 against 59 on the public sector. And you're finding that if by any chance the the government were to give a lower tax rate to hospitals, then I think we will have more facilities, we will have more medical staff towards this, because you will have to incentivize healthcare is a business like any other. So you have to incentivize individuals to invest in that area. We are finding at the moment there are also venture capital firms that are investing in hospitals, in clinics. We also have manufacturers of these pharmaceutical products. We can encourage them so they can produce more. As I said, let the market forces work. As the more you give them a leeway to produce, to supply the market with enough that is required, they lower the prices. And I don't think insurances, health insurances will fill that gap. And that's a matter that I'll talk about in a different aspect, in a different segment. And that's all for me. Till next time.